Today we will learn about the eyeball, or you can say eye, and its whole of the house in which it lies. It lies within the orbit. This is the orbit. Its medial wall is parallel to each other, and they are at the distance of 22 mm. The distance between two medial wall of the orbit, this is the right orbit and this is the left orbit, and the both medial wall are parallel to each other, and the distance between the two medial wall is 22 millimeter. Okay, and it is somewhat, this is parallel, but this is going backward and medially, the lateral wall. This is the anterior aspect and this is the posterior aspect. It is like this. Okay, the anterior aspect, there is horizontal diameter and the vertical diameter. Its horizontal diameter is 40 mm and the vertical diameter is 35 mm. And antero-posterior diameter, anterior-posterior distance of the orbit, this is 45 to 55 mm. And this eyeball constitutes 1/3 of the volume of orbit. I have told the distance antero-posteriorly 45 to 55 mm. But behind the eyeball up to the last point of the orbit, this is 18 millimeter. Okay. Now what is the visual axis and the orbital axis? This is the orbit and the line which is in the middle passing just in the middle of that is the orbital axis. And the visual axis is not such like this. It is going somewhat laterally than the orbital axis. Orbital axis is like this and visual axis is like this. They are making an angle with each other, and that is 20 to 25 degree, or you can say 22.5 degree. Orbital axis is posteriorly, it is medial, but visual axis, which is going in the middle of the eyeball antero-posteriorly, it is somewhat lateral to the orbital axis, backward. Okay, and they are forming 22.5 degree. Now what is the content of the orbit? It is the eyeball, the extraocular muscles, which are 7 voluntary and 3 involuntary. 7 voluntary muscles are first in yellow color. This is superior rectus. This is superior rectus superiorly. And here it is attached. This is the middle point of this is equator, but it is anterior to the equator. All the superior rectus, inferior rectus, middle rectus, lateral rectus, levator palpebris superioris, all these muscles are attached except superior oblique and the inferior oblique. These muscles are attached anterior to the equator at the sclerocorneal junction. Okay. So in yellow color, this is the superior rectus, this is inferior rectus, this is middle rectus, and here this is the lateral rectus in white color. This is the levator palpebris superioris. This is superior oblique and this is inferior oblique. I will discuss it in detail later on, the origin, insertion, hole. Here I am mentioning the content that eyeball with all its extraocular muscles, that is 7 voluntary and 3 involuntary. 3 involuntary muscles are superior tarsal, which is attached to the tendon of levator palpebris superioris, this white one, and elevate the upper eyelid. This is these 3 muscles, that is the superior tarsal, inferior tarsal, and orbitalis. These 3 are smooth muscle. They are not under our control, and the superior tarsal is attached to the levator palpebris superioris tendon, and at the other end it is attached to the upper eyelid and elevate the upper eyelid. Where is the inferior tarsal? Attached to the inferior eyelid, and the orbitalis which lies behind here. There is inferior orbital fissure in which the orbitalis muscle lies, and which is wrapped over by the orbital fossa. Here it is orbitalis muscle lies, and it is above, it is covered by a blanket which is wrapped around all over the orbit, that is the orbital fossa, and this muscle helps in the protrusion of the eyeball, orbitalis muscle. Okay, and supplied by the sympathetic nerve. That's why जब गुस्सा होता है तो आँख थोड़ा आगे की ओर निकल जाता है, help in the protrusion of eyeball. Now coming to the other contents, that the nerve, the optic nerve main for the visual purpose is the optic nerve, and the for extraocular muscles 3, 4th and 6th. Third cranial nerve is for all the extraocular muscle except the superior oblique is supplied by the trochlear nerve, and lateral rectus is supplied by the abducens nerve, and the rest of the extraocular muscles are supplied by the oculomotor nerve. Okay, and 5-1, 5B, that is the ophthalmic and the maxillary division of the trigeminal nerve, they are sensory. The upper eyelid, near upper eyelid, it is sensory, the ophthalmic, and the lower eyelid, it is the maxillary division of the trigeminal nerve. Is taking sensation from there. Okay, and what sort? And sympathetic nerve is there, and also the infraorbital nerve and artery passes from there, and the vein, inferior superior ophthalmic vein, the inferior ophthalmic vein. This what we can see here, that this is the superior orbital fossa. Some part of this is the annular gene, or say common tendinous ring. All the extraocular muscles unite, takes origin from here, and this tendon unite to form the common tendinous ring, which is also known as annular gene. And superior orbital fissure is divided by this circle of annular gene into 3 parts. The middle part, in which there is the common tendinous ring is visible, and part above and part below. Part is, just to make it that, just remember that it is facing laterally. Okay, and it just like a hockey stick, and above it is long and below it is short, and we used to bat the ball by its blunt end, not by the sharp end, blunt end. So just for drawing all these things, that is common tendinous ring in the supraorbital fissure, we should look at that point. Okay, now the above it passes to the LFT, that is the lacrimal and the frontal division of the nasociliary nerve and the trochlear nerve, and in the middle there is भौंकना. एक डॉगी मुंह निकाल के भौंक रहा है, तो भौंकना भी, that is the भौंक. OC means oculomotor, and V हो गया superior division, the inferior division of the oculomotor nerve. भौंक ना, nasociliary nerve and the abducens nerve. और ये नीचे वाले अपर्चर से जाएगा inferior ophthalmic vein, और सबसे ऊपर वाले अपर्चर से superior ophthalmic vein. ठीक है, तो these are the content of the, ये कहाँ जा रहे हैं? ऑर्बिट में जा रहे हैं. तो these are the content of the orbit. We are seeing the posterior aspect, Now coming to the anterior aspect, and what else is there? Orbital fat is there, and the fossa. Two type of fossa. One fossa which covers this orbit, that is called the orbital fossa, and one fossa which covers this eyeball, that is called bulbar fossa or Tenon capsule. Now what is orbital fossa? जैसे हम किसी सामान को पैक करते हैं, कोई इम्पोर्टेंट सामान को पैक करते हैं किसी कार्टून में, तो कार्टून में भी पहले अखबार बिछा लेते हैं, और उसके बाद अगर किसी ग्लास को रखना है तो ग्लास को भी पहले कवर करते हैं चारों तरफ से अखबार से, तब उसके अंदर रखते हैं। तो दोनों ही में अस्तर लगा रहता है, एक सामान प्रीसियस सामान में जो कि आईबॉल है उसके चारों तरफ भी है, और ये कार्टून जो है ऑर्बिट, इस पे भी अखबार बिछा लेते हैं। ठीक है, तो ये फ्रॉम द होल साइड इट इज रैप्ड अराउंड बाय द orbital fossa, as it is orbit, so fossa is orbital fossa. And what are the extension of this orbital fossa? That it is continuous with the optic nerve. Here we can see in yellow color, this is this one. Yeah, this is the optic nerve. Yellow wire is the optic nerve. Always ask in the exam, what is the relation of optic nerve and ophthalmic artery inside the optic canal? So optic nerve is, just remember that ईला अरुण को समन मिला है। ईला अरुण एक एक्ट्रेस है जो बहुत वल्गर गाना गाती है, तो उसको हमेशा कोर्ट से समन मिलता रहता है। ठीक है, तो ईला अरुण को समन मिला है, तो ईला एंड समन, ILA, that is artery is inferolateral, summon nerve, that is optic nerve, is superomedial. ठीक है, इस तरह से हम लोग याद रख सकते हैं। अब what we are saying, that is the orbital fossa. ओके, तो ऑर्बिटल फासा फिर आगे कंटिन्यू होकर ऑप्टिक नर्व को भी रैप कर लेता है, और पीछे बाहर निकल के ये डूडल सीट से कंटिन्यू हो जाता है। नाउ कमिंग टू द bulbar fossa, which covers bulbar or Tenon capsule, which cover the eyeball, well, but only up to the sclerocorneal junction where these extraocular muscles are attached, only this much. And in between this Tenon capsule and the eyeball there is a space, episcleral space, in which the eyeball rotates freely. Okay, and this fossa which covers the eyeball, it gives few extension, and the above it gives one extension which cover these two muscle, this white and yellow, this is the levator palpebrae superioris and the superior rectus. Above extension of the Tenon capsule, here it wraps these two muscle. Now medially it wraps the medial rectus muscle and then form medial check ligament, through which it is attached to the lacrimal bone. It holds the eyeball in position. This extension hold the eyeball in position, and the lateral rectus, it is wrapped around by the extension, that is called lateral check ligament. Okay, and the inferiorly there is inferior rectus and inferior oblique. Okay, the yellow inferiorly in yellow color, this one, this is the inferior rectus, and this one is inferior oblique. Both this is holding by the suspensory ligament of Lockwood. Dr. Lockwood has discovered this ligament. It helps to prevent the depression of the eyeball, this suspensory ligament. Okay, so suspensory ligament of Lockwood lies here. It is the extension of the Tenon capsule inferiorly, and it encloses the inferior oblique and the inferior rectus muscle. Okay, now this is all about the extension. One tubular sheath covering the orbitalis muscle also. Okay, and also there is that orbitalis muscle lies here, and it is covered by the orbital fossa. And orbital fossa, I have forgotten to mention in that time, that is the orbital fossa. It covers the orbitalis muscle here, and anteriorly it covers the it forms the orbital septum. It thickens somewhat to form the orbital septum from superior and the inferior aspect, as well as it forms the lacrimal fossa, which covers the lacrimal groove. Lacrimal fossa, which covers the lacrimal groove, which contain the lacrimal gland. And also there is the lacrimal gland lies here, and the lacrimal nasolacrimal duct lies here. And along the medial canthus of the eye, this is lacrimal punctum and lacrimal duct is there. Okay, lacrimal sac, nasolacrimal duct, and lacrimal gland lies here on the lateral aspect superiorly. So now coming to the origin and insertion of extraocular muscles, the superior rectus, this in yellow color, this is superior rectus. It takes its origin from the this is the common tendinous ring. It takes its origin from the superior aspect of the common tendinous ring. This is superior rectus, this is inferior rectus on the inferior aspect, this is lateral rectus from lateral aspect, and from the medial aspect it is the medial rectus. All these are going attached on the medial, lateral, superior and the inferior at the sclerocorneal junction. Okay, and this is the levator palpebrae superioris, which is going to insert just above the superior rectus. This is superior rectus, and just above this is levator palpebrae superioris. It takes its origin from the orbital surface of the lesser wing of the sphenoid. This is the lesser wing of the sphenoid, and this is the body of a sphenoid, in which a sphenoidal sinus is there, and this is the lesser wing. So orbital surface of the lesser wing of the sphenoid, it takes origin from there and attaches at the sclerocorneal junction superiorly just above the superior rectus. Okay, now what about the superior oblique muscle? That was levator palpebrae superioris, and this is superior oblique muscle. It takes its origin from the body of the sphenoid, orbital surface of the body of the sphenoid, and it is going anteriorly superomedially. This is a pulley which is again formed by the condensation of the orbital fossa. This pulley, a pulley is also known as trochlea. That's why the superior oblique, as it is supplied by the trochlear nerve, and the nerve get its name only due to this pulley or trochlea, that trochlear nerve. Superior oblique, this muscle lies only up to here. Now it turns into a tendon. Now tendon is going inside this pulley, and now it is coming obliquely. That's why it is known as superior, from superior aspect and going obliquely, so superior oblique. And now it is inserting here. That all these other muscles are going sclerocorneal junction, that is anterior to the equator, but it is going posterior to the equator and somewhat laterally. Okay, like this, obliquely. And this is the inferior oblique. It takes its origin from here, but it is inserting just beneath the superior oblique, where it is inserting. This is the insertion point of inferior oblique, and inferior oblique is just lying deep to the lateral rectus. This is the lateral rectus, and but it is passing superficial to the inferior rectus. This is inferior rectus. Inferior oblique also passes obliquely and inferiorly. That's why this is known as inferior oblique, but it is deep to the lateral rectus muscle and but going superficially to the inferior rectus, and both are locked in the suspensory ligament of logwood. Okay, now where it is going, from where it is taking origin, just lateral to the lacrimal groove. This is the lacrimal groove, and this is the lateral, just lateral to the lacrimal groove. This is the orbital surface of the maxilla, which is at the anterior margin of the orbit. This is the anterior margin of the orbit, and this is the origin of the inferior oblique muscle. Now coming to the function of this muscle. As I have not made tenon capsule, so for understanding the function, we have to draw on paper. So, but superior rectus, when it contracts, this is yellow one. Superior rectus, when it contracts, the eyeball, the pupil moves up. This is called elevation. When inferior rectus, this below, this contract, the eyeball moves down. So this is depression. When superior rectus contract, this shows elevation. When inferior rectus contract, this shows depression, because pupil is facing inferiorly. When medial rectus, this is the medial rectus, when it contract, it's shortened and the pupil going towards the nasal side. This is called adduction. When lateral rectus contract, the eyeball goes outward. That is called abduction. But there is combined movement also, which I will discuss in a copy. Just to make the action, suppose this is the eyeball, this is medial, lateral, this is the right eye, this is left eye. Okay, this is superior rectus, this is inferior rectus. By the side of superior rectus, this is inferior oblique, and below this is superior oblique. Along the medial side, this is medial rectus. Along the lateral side, this is lateral rectus. And then in the middle, this we have to first we also have to draw like this, inferior oblique, and this is for the superior oblique. Okay, now a big oblique line from here to here going upward. Now a big oblique line from here in the middle to here. This will describe the function. Okay, what does superior rectus do? Superior rectus is superior, ये राजा है rectus. ऑब्लिक पे उतना ध्यान नहीं देना, ऑब्लिक गोज ऑपोजिट, वो ऑपोजिट काम करता है. ठीक है, सुपीरियर रेक्टस ये राजा है, ये हमेशा राइट होता है. सुपीरियर है, अगर नाम में सुपीरियर है तो ये सुपीरियर है, ये ऐसा ऑपोजिट काम नहीं करेगा कि हाँ डिप्रेस कर दे. तो सुपीरियर रेक्टस व्हाट डज इट डू, इट्स कॉज एलिवेशन, और ये मीडियल एस्पेक्ट है ना, सो एडक्शन एज वेल एज द मीडियल की तरफ ये है तो इंटॉर्सन. एडक्शन एबडक्शन जो ऐसे ऐसे मूव कर रहा है, दिस इज अलोंग द हॉरिजॉन्टल एक्सिस. एंड और एलिवेशन डिप्रेशन ये किस वर्टिकल एक्सिस पे काम हो रही है, और इंटॉर्सन एक्सटॉर्सन जो है एंटेरो पोस्टीरियर एक्सिस पे काम हो रही है. ठीक है, तो ऐसे करके सुपीरियर रेक्टस का क्या फंक्शन हो गया. सुपीरियर रेक्टस एलिवेशन करता है, फिर एडक्शन करता है, एडक्शन, और इंटॉर्सन। फिर उसके बगल में कौन है, इन्फीरियर ऑब्लिक है, तो इन्फीरियर ऑब्लिक क्या कर रहा है, वो भी एलिवेशन कर रहा है। फिर इन्फीरियर ऑब्लिक के लिए ही ये बनाएंगे, लैटरल रेक्टस का ये वाला है, ठीक है ना, ये लैटरली गोइंग लैटरली। इन्फीरियर ऑब्लिक ये 3 काम कर रहा है, ये 3। तो क्या क्या कर रहा है, एलिवेशन कर लिया, फिर एबडक्शन करता है, एबडक्शन और एक्सटॉर्सन। ये बाहर की तरफ जा रहा है ना एरो, मीडियली तो नहीं है, लैटरली है, तो एक्सटॉर्सन हो गया, ठीक है। अब मीडियल रेक्टस जो है वो सिर्फ एडक्शन कर रहा है, लैटरल रेक्टस जो है वो सिर्फ एबडक्शन कर रहा है, इधर जा रहा है इधर जा रहा है, सिर्फ इसका एक ही एरो है, इन बाकियों का 3 एरो है, ठीक है। अब इन्फीरियर रेक्टस क्या कर रहा है काम, इन्फीरियर रेक्टस क्या कर रहा है, डिप्रेशन कर रहा है, फिर मीडियली जा रहा है ना इधर, तो फिर ये एडक्शन करेगा, और फिर इसका ये वाला जो एरो है ये किस तरफ डिनोट कर रहा है, एक्सटॉर्सन, तो हो जाएगा एक्सटॉर्सन। फिर अब आ जाते हैं सुपीरियर ऑब्लिक। सुपीरियर ऑब्लिक क्या कर रहा है, सुपीरियर ऑब्लिक कर रहा है डिप्रेशन, ऑब्लिक गोज ऑपोजिट, है ना, डिप्रेशन। फिर ये इस तरफ जा रहा है तो मतलब एबडक्शन कर रहा है, एबडक्शन। और ये बीच वाली लाइन क्या बता रही है, इसके और एरो को देखना होगा हम लोगों को, यहाँ पे एरो यहाँ पे है जो मीडियली जा रहा है, तो ये इंटॉर्सन हो गया, ठीक है। तो ये सारे एक्शंस हो गए सारे एक्स्ट्राओकुलर मसल्स के। और जो कि थी इनवॉलंटरी होता है तो सुपीरियर टासल और इन्फीरियर टासल, जिसका एलिवेट द आईलिड, एलिवेट द अपर आईलिड एंड एलिवेट द लोअर आईलिड, और क्या हो जाता है, ऑर्बिटलिस मसल का हो जाता है प्रोपल्सन ऑफ द आई बॉल, ठीक है। और इसको सप्लाई कर रही है सारे नर्व्स, वो तो बता दिया मैंने, और पोजीशन भी हो गया, दैट्स ऑल।